Thank you, Babatunde. Good morning, ladies and gentlemen. My name is James Hospedales, the Executive Director of CARPHA. I've been laid low by flu for the last couple of days, so if those of you who met me this morning, I'm not shaking anyone's hands. That's not the way to stop chikungunya, just flu. However, there are a lot of misconceptions about chikungunya that will challenge us, continue to challenge us. Dr. Tilak Dari, Principal Medical Officer, Environmental Health, Ministry of Health, Trinidad and Tobago. Bernadette Theodore Gandhi, represented by our colleague from PAHO WHO, Aldana Boisson. Babatunde Olawokure, our Director of Surveillance, Disease Prevention and Control, Chair of this morning's session. Member States of CARPHA, Senior Statesman in Vector-Borne Disease, Dr. Elisha Tikasing, who's been at this thing since most of us were little boys and girls. Invited guests, Dr. James and Catherine from the OECS Health Desk, participants, ladies and gentlemen, members of the media. It's my pleasure to welcome you to the opening of this expert consultation on chikungunya. We've had a lot of, we feel we should have had a conference, but there's been so much interest in this. As we're all aware, chikungunya, or CHIKV, made its appearance for the first time in our region in December of 2013, with local transmission first detected in one of the French departments. And then, in short order, one country per week, one every 2 weeks, it spread throughout the region, with our intra-regional travel, high levels of vector mosquitoes, ensuring that we all became infected. The virus worked its way through the region. Within a year, all 24 CARPHA member states and several with other countries within the region had been affected. If this had been a more lethal virus, this would be a very serious situation. And chikungunya is a big flag that what we have been doing hasn't been working in terms of control of vector-borne diseases. Dengue before this has been waving that flag, but this has been a big new flag. As expected, this new disease entity has had a significant impact on affected populations, as large proportions of the population became ill simultaneously. In Jamaica, the president of the Private Sector Organization of Jamaica estimates 1 percentage point of the GDP last year because of the high numbers of illness in the population. Simultaneously unable to perform their routine functions for periods varying from a few days to a few weeks. As Caribbean populations, we continue to be challenged by the management of chronic pain and disability, which have reared their ugly heads, and the economic impact of both the acute disease and the chronic sequelae remains to be fully quantified. In my home, my wife contracted it in October. It's now 5 months or so. She's a veterinarian. She cannot give an injection because of problems with joint pains in her hands. And every week it seems as if there's some new manifestation of the problem. I suspect if I ask for a show of hands, a lot of people here would have had chikungunya in their family. Quite a lot of hands going up. Our responses to this epidemic have been informed by the existing knowledge about the importance of vector management and personal protection against mosquito bites. But the rapidity of spread of the virus indicates that a response of a wider scope is required to support the efforts of environmental health agencies, traditionally tasked with the response to vector-borne diseases. And I think a wider and more participatory response. All our public health agencies have been saying mosquitoes spread this disease, that there's a widespread disconnect at the population level. Most recently, a gardener in a hotel said, no, but we've always had mosquitoes. So how come this thing just reached? It comes from some lab. This is to kill black people. Another one, a very educated person, a cabinet member in one of our member states said to me recently, you know, Doc, it's only as you talk and I just realized something. I've been wondering how the mosquito going from island to island. But there's people going from island to island and carrying the virus, mosquito bite them where they go. So we have been communicating and not reaching through to people. And someone who is an after-school homework supervisor in our church said recently, it's impossible, the mosquito can bite everybody in your family. Look, the father, the mother, everybody gets at the same time. So we have not succeeded in our communication messages as much as we have spent and put into it in reaching people. And that, I put that one as one big first challenge, because if we solve that, telling people to clean up the mosquitoes breeding in the yard, telling people to wear insect repellent, stay under a bed net, all these things will have limited all these things will have limited impact if people don't believe that it's mosquitoes that are spreading the disease. So it's said that a definition of madness is doing the same thing repeatedly and expecting a different response. It seems in some ways we've been doing that. In some of our countries, we spend a large amount of money on vector control. And doesn't seem to have slowed down the chikungunya too much. It's time to look beyond our well-worn response toolkits and begin examining new approaches and incorporating technological innovations such as real-time disease reporting, where we allow people to use cell phones to report and send them back messages right away on what to do to avoid mosquito bites. And considering supplementary approaches to vector management. There's a need to step forward and accept the challenge that chikungunya and others before it, such as dengue and West Nile, have provided and dared to do things differently and engage different partners. What we have been doing has not been working. We have to work in a different way. No one person or one sector, neither the public sector, nor the private sector, nor people have the solution. I really believe that. If this had been a more lethal virus, we'd be in a very different situation. It's also an amazing phenomenon in public health to witness a new disease come through a whole population that's a virgin population. 30 years ago, HIV arrived in this part of the world. Enormous effort was put to mount up attention and mobilize resources. It went up and it's declining, and we're beginning to see the light at the end of the tunnel. We're talking about eliminating transmission in 10 years. 20 years ago, cholera came back to the Americas after 100 years of absence and threatened the islands of the Caribbean. I recall being down in Guyana, being in Belize and fighting cholera 20 years ago. It never got into the islands until a couple of years ago when it came by a very unexpected route into Haiti, where it still resides. So having the opportunity in public health to experience a new emerging infectious disease such as this one is a remarkable phenomenon. And there are a lot of research questions that we have to examine where chikungunya is concerned. The intention during this consultation is to look at what we already know about CHIKV and to examine carefully what we've learned from our collective experience in confronting the epidemic. We will be covering a broad range of topics: the epidemiology, the clinical presentation, care and diagnostics, the role of research and innovation, the importance of communication, the economic impact of this ailment on it's expected that in sharing the information and the experiences, we'll arrive at a common understanding of the challenges we face as a region, as well as the opportunities to mitigate these challenges through new approaches. The importance of multi-sectoral collaboration I've been talking about, it cannot be overemphasized. The Partners Forum that we're planning on day 3 presents a unique set of opportunities for cross-fertilization of ideas and potential mobilization of capacities and resources from government, from private sector, and from other organizations. The benefits of such interactions are legion, and we hope we can capitalize on them in meaningful ways. In winding up, I must thank the European Union, which is the principal supporter of this event. Thank also Oxitec and Univar for some financial support. I encourage you to make the best possible use of the time we spent together here, and look forward to the dawning of a new era of closer collaboration in this public health response, not only for chikungunya, but for challenges of all kinds, for our people and for the tourism industry that we're so dependent on in this region. Thank you very much.